Well, what about our hospital census?
Yeah, that's where
Is that where you're going?
Going to
Oh,
Kaweah
okay.
Delta now.
All right.
Yeah. So just a few weeks ago, and this is kind of one of my opening remarks yesterday at the press conference. It was on a Saturday. We hit our all-time high number of COVID inpatients that were in the medical center. We were at 91. Pleased to report this morning we're at 35. And we've been staying pretty much at 35 for at least a couple weeks. Feels like almost 3 weeks. We're now far enough removed from the 4th of July holiday. And I think that's been the experience statewide, that the COVID numbers have been dropping. Generally the West Coast, the Sun Belt states have seen their number of hospitalizations declining, number of positive cases declining. At the same time, the Midwest apparently is starting to experience quite a breakout, almost like what we saw in July. They're now seeing at the tail end of September or August, and now maybe into early September. Of those 35 patients that are in-house right now with COVID, only 6 of them are in the ICU. So that's really good. Again, we're seeing that that while hospitalizations are dropping, at the same time we're also, I think, experiencing more success in taking care of hospitalized patients, using remdesivir, an antiviral, using steroids, doing what they call proning, which is turning the patient onto their stomach, those that are ventilated. We're seeing actually the length of stay for patients that are admitted with COVID, that they're getting better a little bit quicker. So those are all good signs. And again, I don't want to lose any of that momentum, as we go into Monday's holiday. Also, very, very positive news. We have less than 35 of our employees that are quarantined at home. So again, it wasn't too long ago we had more than 100, and we were consistently running at that. We've had probably 350 employees over the course of the pandemic that did contract the virus and had to be quarantined. But we're seeing fewer and fewer of our employees contracting the virus, and to have almost all of them back working, which has been wonderful. We've definitely seen our staffing get a little bit better too because of them returning to work. The census right now, it's really interesting, and I apologize. This is the most ill-prepared. I might be faking it really well right now so far, but I've had a pretty hectic morning, and I would normally already know this information, but so I'm looking for the first time at one of my printouts here. But it looks like we're running about 80% occupancy overall as a hospital. We were really, really tight in our non-COVID units actually just about a week ago. So even though COVID volumes have really come down, non-COVID volumes have been going up. And they're literally, we might have been struggling to find 1 or 2 beds in the Mineral King wing. The non-COVID units were bursting at the seams. But we've seen a little bit more wiggle room, but I'm looking at, I had actually, yesterday, we had 27 non-COVID beds that were empty, and 3 or 4 beds on almost every unit. So I'm now looking here, and we're at 14. So we have 14 non-COVID beds that are open, 27 yesterday. So, and this is just a point in time. There'll be lots of discharges. Every single day we discharge 40 to 50 patients. But then we admit a lot of new patients too. But definitely we're feeling a little bit of respite from this, a little bit of kind of elbow room to move around. So.
Okay, perfect. Can we go back to the deaths?
Yes.
Because a question has come in. Do we have a report that shows the comorbidities of people who have died from COVID?
Yeah, I think I've reported on that a couple times. Doug Leeper, our Chief Information Officer, he's kind of become our COVID statistician or guru around the numbers, and we have this system that integrates with our Cerner electronic health record called Healthy Analytics that allows us to pull out a tremendous amount of incredibly valuable information. So I'd asked Doug, because that question has come up quite a bit, and he literally provided me like the top dozen underlying what they call comorbidities, comorbid conditions that a patient has, which in layman's terms is like what chronic conditions do they have. So diabetes, high blood pressure, chronic obstructive pulmonary disease, COPD, congestive heart failure, things of that nature. Far and away, hypertension, high blood pressure, and diabetes are the two most prevalent chronic conditions that we see that when combined with the COVID virus put people in the hospital. Now, that's really uncontrolled hypertension and diabetes. So I have high blood pressure myself, but I'm under the care of a doctor. I take an ACE inhibitor every day, lisinopril, very common hypertension drug. And so my blood pressure is 125 over 78, something like that. So I have controlled hypertension. People have very controlled diabetes, but unfortunately, a lot of people have uncontrolled diabetes. And so if your hypertension and your diabetes are being well managed, well controlled, while you may have a higher risk of having to be hospitalized, I don't know if it's that much higher. I don't know if Dr. Nguyen, Dr. Nguyen's probably not on the phone today, but I don't know if they would have a higher risk than somebody that didn't have those underlying conditions. But clearly, if you have uncontrolled diabetes, uncontrolled hypertension, your risk factors are significantly higher. But then as you start going down, and again to a decreasing degree, patients with other respiratory conditions like COPD, like asthma, tend to not respond as well, when they contract the virus, that these underlying conditions exacerbate their difficulty in breathing. And if you have congestive heart failure, there's still a lot of studies going on, but there seems to, the COVID virus definitely can wreak havoc on our organs, and particularly our heart. And so we see a lot of correlation between COVID and having heart problems. So again, patients with congestive heart failure are having a more difficult time responding.
Right. So the numbers, it feels like the reports and the numbers are constantly changing. If you're watching TV, you're on CNN, or Dr. Fauci was just on, the CDC just reported some numbers, and the community, it's very confusing to them who to believe. So as the CEO of Kaweah Delta, what is the true death rate? What is your opinion of the true death rate from COVID?
Well, I don't know if I know the answer to that. I mean, certainly, as I just shared a moment ago, I know what the mortality rate is for Kaweah Delta and for our county and what we've seen.
But do we know which deaths have been just COVID without any comorbidities?
No, I suppose you could derive that, but there's a specific diagnoses code that where COVID is primary. So you have all these other secondary diagnoses, these underlying chronic conditions. But what brought you to the hospital was COVID. Now, what happens, and I think I talked about this last week, is COVID, is a respiratory condition. And it makes it very difficult to breathe. And oftentimes, every day I get an email that provides every mortality to me that happened in the hospital and tells me the whole history about the patient and why they died. And it will say whether they died of COVID or something else. And I noticed that for those patients that die of COVID, universally their oxygen saturation levels have been plummeting as they deteriorate. So their lungs are not able to produce the oxygenation that we normally have. And right now we're probably at 98, 99% oxygenation. So we have great oxygen flow in our bloods, which nourishes our organs. Our organs need oxygen-rich blood to function. So what happens is when you can't breathe and you can't produce that oxygen-rich blood, your organs start failing. When you have multiple organ failure, we call that sepsis, septic shock, where you're in massive organ failure. So the patients often die of sepsis, where their kidneys stop functioning, their livers stop functioning, their hearts stop functioning. But it was brought on by COVID. It was caused by COVID. It might have been exacerbated by one of their chronic conditions, but we would call that a COVID death. Now, if somebody was in a traumatic, automobile accident and came in and we did everything to save them, but we couldn't, and they also tested positive for COVID, we wouldn't call that a COVID death. COVID would be listed as present, but it would not be a COVID death. I think where the confusion lies is, okay, what if somebody came in with a heart attack and they died of their heart attack and they were COVID positive? Did COVID cause the heart attack? There's a strong belief in that. The patient still might have had a bad heart and might have had a heart attack if they didn't have COVID, but COVID might have accelerated that. And so do you call that, do you call that a COVID death or they died of a heart attack? And that's where the physician has to exercise their judgment. We look at all the things that are going on with the case, but if it's clearly that they came in for COVID and that's what we were treating, we're going to call it a COVID death. So I don't know if that, when Dr. Fauci talks about, there's always that kind of subjective piece. Is it COVID or not? So that's hard to get rid of. But then definitely how you're reporting the death rate. Is it, the percentage of people that had the virus that died? That's our 1.67%. The state's reporting 1.8%. But then there's, okay, what percentage of the actual population dies? Well, for us, that's 0.05%, or 51 deaths per 100,000 people. So that's another way to report the death rate. So, and obviously the death rate varies county to county, country to country. Our death rates in the United States are different than the rest of the world. Now, they're probably somewhat similar, but I actually haven't looked at the death rates from COVID state by state. That would be interesting, or even county by county. There definitely have been some counties that have reported no deaths, or maybe one death, but they probably have much smaller populations. So, and that is a report. Doug sends it out usually once a week, ranks the top 23 most COVID counties in the state out of the 58 and where we're ranked. And again, Kaweah Delta ranks number 3 for mortality, but there are counties that have incredibly low mortality. But they also tend to be more rural, where there's not as much congestion of people. They're much more spread out where they live and don't congregate, like they would. That's why you see the highest mortality rates are in LA and the Bay Area, where you have lots of people that, really it's quite dense, the population.